In the intense world of medical emergencies,
I'm worried that you punctured your right lung.
there's nothing more extreme than a code red.
He's been hit by that JCB vehicle there.
It means there's an immediate threat to life.
Any pulse? Can you just check?
No, I can't feel anything.
In the West Midlands, highly specialist teams are ready to react to these major traumas.
Patient's fallen from top flight of the stairs.
By road
Our ETA is about 2 minutes.
and air.
Patient has a large wound. Yeah, affirmative, all received.
These emergency doctors and specialist paramedics
I'm going to get you out, all right?
use cutting-edge trauma techniques in surgery, normally only seen in operating theatres,
John, there's some more very strong painkiller going in now.
to save people from almost certain death.
Celox, please, at major hemorrhage.
OK, stand clear. Shocking.
From car crashes
Rob, I'm just going to lift your feet and we're going to look at getting you out, OK?
to stabbings.
Gentleman has turned on Sean with a meat cleaver.
Filmed alongside the critical care teams,
If we'd have left it, your heart wouldn't have restarted.
we captured every vital second as these specialist crews work to save lives.
Let's get him on the ambulance.
Lift. Okay, nice and high.
Honestly, trust us.
Tonight,
And there is no pulse.
a 57-year-old man fights for his life after his heart fails.
Doing the best we can for him at the moment, okay?
I've lost so many times, nearly lost him.
The air ambulance is scrambled when a road traffic collision leaves one woman with possible spine and hip injuries.
Looking at the intrusion and the damage, I would be shocked if she's okay.
A victim of a brutal attack needs urgent care.
Right ear is partially amputated.
Can you feel me touching there, David?
And a man needs emergency help when his leg is crushed by his own car.
You're struggling.
Ambulance service. What's the reason for the call?
We've just witnessed an accident on the Bridgenorth Road. There's a car in the hedge, right side up. I can't see those passengers.
Everyone happy? Yep.
Midlands Air Ambulance charity Helimed crew are immediately scrambled to a serious road traffic incident in Bridgenorth.
Everyone, all is normal. Moving left.
On board, a critical care paramedic Tom Waters and Dr. Mark Nash.
6 minutes. Yeah, that's 12 miles. Okay. This is a two-car RTC with possibly 2 people trapped and with quite large intrusion into the passenger area of one of the vehicles.
The Helimed team have been dispatched to provide specialist care as quickly as possible. Mark is a consultant anaesthetist, and his high level of training in surgery and pain management could be vital in such a critical emergency.
We've just been tasked to the Bridgenorth area to report on a 2-car road traffic accident with a couple of people trapped in the car. So we'll be there in a couple of minutes. We may be the first ambulance asset to see. Blue light scene. Yeah. Right. I'm content here if you guys are. Yeah. Okay, landing.
Already helping out on scene are an ambulance crew, fire and police. They are most concerned with one woman who is still trapped in her car.
Great.
This is Pat, 60 years old. She's had a head-on which has spun her, causing obviously significant intrusion into her side.
The officer in charge briefs Mark on their observations.
Since we've been breathing, there's been 16 and 14. Pupils equal and reactive. She's had no loss of consciousness. It's just the intrusion.
Okay.
She is querying, barely touching the back of her neck. Here at C-spine, so very, very painful.
That's a big smack, isn't it?
The 2-car collision happened on a slight bend in the road. The car the patient was a passenger in smashed side-on through a metal gate into the field, throwing her body into the car door.
Any other patients that you...
There are a couple others.
Okay. I'll everyone else, and then I'll be back. Yeah, I saw that.
While Tom goes to check on the others involved, Mark starts assessing the patient, Patricia.
Hello, I'm Mark, I'm one of the doctors. You've been chatting to her okay?
Yeah,
Fine.
she's got groin pain,
Okay.
both left and right side.
And is it hurting your soft tummy area?
No.
And do your legs feel like they're squashed in together? Or not too bad? Have you moved your right leg? Have you lifted your right leg up? Does that hurt you doing that? It hurts. In the groin? Yeah, okay.
Groin pain could be a sign of pelvic injury. If such an injury becomes unstable, internal hemorrhage can occur, which can be life-threatening.
So I think once out on a trolley, we can assess a look at things again and we'll see how we go.
Although Patricia is conscious, Mark can't assess the extent of her injuries until she is out of the vehicle. And with some pain in her neck, he also cannot rule out a spinal injury.
They plan to pop this side out this side?
It's essential Mark and the fire crew work out a way of freeing Patricia quickly and as safely as possible.
It's not going to really help taking her out up that way. She's going to have to go up that, isn't she, vertically? I mean, is this freeable? Because I mean, that will just swing and let her drop out that way. Is this left leg, does it feel like it's got anything wrapped around it? Is it free as far as you can? So everything's free, isn't it?
If Patricia has suffered internal injuries, such as a pelvic fracture, any movement could cause severe damage to internal organs. And if her spine is damaged, she is at risk of paralysis.
Your way here, potentially take her out the side, out that way and go out that way.
Having assessed there are no other patients needing his critical care, the focus for both Mark and Tom is firmly on Patricia.
It's really hard to tell what her injuries are. Looking at her age, the intrusion and the damage, I would be shocked if she's okay.
While the fire service prepare for cutting Patricia out, Mark and Tom need to keep her relaxed.
We're just thinking about whether or not we can get a drip into you sooner rather than later. Is this your favourite top? It's new.
Hey, she's worried about the new top, so it's good.
Until she can be freed from the car, their only option is to keep her comfortable with a mild painkiller until they can fully assess her injuries. Tom needs to get a cannula into Patricia's arm to administer fluids quickly and easily.
Hello, you've been speaking to my colleague. My name's Tom. You're a love. Can I cut your new coat? Do you mind?
I have no choice though.
No, you don't, I'm afraid.
I've got a funny feeling it's going to be busy.
It's Sunday evening, and critical care paramedic Jenny Mealy is on shift.
It's the last weekend before Christmas, so we'll see what it brings.
Service, is the patient breathing?
Yes, he's breathing.
Okay, is the patient awake?
No, I don't know. No, I can't.
He's not awake?
He's not talking. His eyes are a tiny bit open. His tongue is sticking out a bit. It's blue. Tongue is turning into grey blue.
Okay, I need to tell you how to give it life support, okay? So I need you to kneel by his side.
Yeah.
Put one hand flat in the centre of his chest.
Yeah.
Put your other hand on top.
Yeah.
You need to push about 2 times a second. Push, push, push.
Push, push.
They're going to come as quickly as they can, but you need to keep going until they come into the house, okay?
Push, push, push. Push, push, push.
Medic 53 en route, ETA 15 minutes, over.
2 ambulances have been dispatched, but with a patient's life on the line, the enhanced life-saving skills of the critical care team are urgently needed. Tonight, Dr. Naveed Kaur Mahalla is partnering with Jenny.
I'll give the crew another call shortly.
That's all received, thank you. We've just been called to a suspected cardiac arrest where the first crews arrived and said that the patient's in a VF rhythm, which means ventricular fibrillation, where the heart is beating in a completely disorganised manner, and that's one of the rhythms that can be shocked and defibrillated back into a normal rhythm. So it's really a time-critical event.
Although the first ambulance crew arrived on the scene within 2 minutes of the 999 call with a defibrillator, the patient's heart is still in a dangerous and sporadic VF rhythm.
Medic flight on scene.
Hello.
Ambulance.
The 57-year-old patient, Kavi, suddenly became unwell whilst in bed and is now in cardiac arrest.
So guys, to offload us, should we try and get the Lucas underneath just to kind of free everyone up?
Unlike ambulance crews, the critical care team carry a specialist device called a Lucas to automate CPR. It gives chest compressions, pumping blood around the body, which gives a chance of restarting Kavi's heart.
Right, so what we need to do between you and I, hi, I'm Jenny, is sit him forward, shove this under and then put that on. Ready? On 3, 1, 2, 3. Perfect.
The team can now be freed up to perform other treatment to try to get the heart beating independently and in a normal rhythm.
Right, so what's been your latest rhythm on rhythm check?
Yeah, we will do another one.
So it looked like an asystole PEA type thing.
On checking the heart's rhythm again, Dr. Naveed discovers the patient is now asystolic, which means there is no electrical activity at all. It is now unshockable by a defibrillator. The longer Kavi remains asystolic, his heart will not be restarted successfully.
Is that the first adrenaline just going in?
First adrenaline is about to go in, yeah.
Okay.
So, airway, drugs, access all sorted.
Injecting adrenaline is a way of increasing blood flow and helps any chance of restoring a heartbeat.
The other thing we could do, we could get some fluids run through. It doesn't seem like a hypovolemic arrest.
A hypovolemic arrest means that the patient became ill due to blood or fluid loss, which could have occurred from internal bleeding or even an illness like severe diarrhea.
Got a rhythm check coming in 25 seconds.
Getting a pulse again now is critical to any chance of his survival.
Yeah, so I've got a good pulse with the Lucas on. Yeah, please. And there is no pulse. Oh, hang on. Yeah, we do have a ROSC.
ROSC, or return of spontaneous circulation, means the patient's heart is now pumping again on its own. But less than 1 in 10 people who suffer an out-of-hospital cardiac arrest survive.
Disconnect from the defib, and then we'll take him downstairs.
In Bridgnorth,
She's almost out. We can almost like follow it and get her out that way. That'd be ideal.
60-year-old Patricia is stuck in a crash vehicle with suspected pelvic and spinal injuries.
Yeah. Keep an eye on her, just keep her nice and warm. Perfect. Are you okay there? We're going to get you out, all right? You're doing ever so well.
Midlands Air Ambulance critical care team Tom and Dr. Mark have been liaising with the fire service about how best to extract her from the car.
What I'd like to do is pop a needle into her arm. Is that okay?
Whilst they wait, Tom needs to give her pain relief intravenously.
Pop this out. Is that hurting at all? Is that all right? I'm so sorry. Sharp scratch. And then you can relax your arm down and then hopefully we'll get you out. Can you just pull that front bit and just peel it back? Yeah, that's it, well done. Keep on doing that, perfect, brilliant. A bit more. Keep going. Yes, that is ideal.
With a potentially serious internal injury, moving Patricia could cause her condition to suddenly deteriorate.
So I think what I'd like to do is we're going to get our bed here, and I think we'll get as many people as we can, and we're just going to literally pick her up and put her onto the scoop.
A scoop stretcher ensures Patricia is well supported. But if she has suffered broken bones, any movement at all is likely to be extremely painful.
as you can, nice and easily pick her out. Where's that pain, love? In here. Okay. Okay. All right, we're going to have to get you out because you're nearly out of the car, aren't you? We're just going to have to carry you, okay? One person on the legs. Yeah. Lord, you go on the legs then. So she's coming out now. She's in quite a bit of pain.
Although Patricia is in a lot of pain, it's essential they get her out of the car as quickly as possible.
And if everyone's ready, we're going to go on 3. One. Yeah. Well done. Wait there. Work there. Well done. There you go. There you go. There you go. Well done. Yummy. Well done. Well done.
Tom oversees the fire crew as they move her to the stretcher.
Well done. Well done. That's it. Perfect. Well done. That's brilliant. That's what we wanted. You're back. I'm just going to slide 6 inches towards you. And we're going to go when Mark's ready. Everyone happy? Yeah.
We're just going to move you down a couple of inches. Ready, steady, go. That's it, we're on.
Perfect, well done. Right.
Right.
That's great, well done. Cracking. Thank you. I'm just going to cut your trousers off, love. I'm ever so sorry.
Can I just pull this left arm again? I'm just going to do a bit of blood pressure on there. Right. So I'm going to prop that arm by your side just for 2 secs. Right, can you feel there? Is that okay? It's going to go very tight around your arm. It's not the best of positions, but it will do. Is there pain in your tummy at all? Not at the moment. All right. So you're going to feel there's something very tight around your hips in a minute.
Okay. To give Patricia's hips and pelvis as much support as possible and to avoid any further internal injury, Dr. Mark attaches a pelvic binder around her hip area.
Okay. And can you move your legs around at all for us? Can you, if you look at me, if you see my feet, if you feel like that, are you able to move your feet apart? Does that hurt you in the groin doing that?
The top of the leg.
Top of the leg. Around here?
No, the other side.
Around this side here.
Dr. Mark is assessing the movement in Patricia's legs and feet for any indication of pelvic injuries.
So if I gently move this, is that okay? And that's okay. Let's tuck them up underneath. So the current situation is your blood pressure's good, your heart rate's good.
Yeah.
Our main concern is your hips. Okay, and as you get older, you can squash your pelvis.
You're all right. I've been a carer.
So if you look at your car, it's got a lot of bend in the door and the seat's twisted. You've been pushed, and that's our concern about this hip. I think given everything that's going on, we're probably going to fly you to the Queen Elizabeth Hospital in Birmingham. Let them check you out there, and then we go from there. Okay. And I think we're now ready to go. All right.
Patricia needs an urgent scan and treatment at a specialist trauma hospital.
Everyone happy?
Yeah. Cool. Perfect. Thanks so much.
Line up in there. Just watch your heads on the aircraft. That's great. Cheers, guys. How are you feeling? You are? Oh, you're ever so happy. That's great.
Can we put alert into QE, please, for 25 past? Yep, so 60-year-old female, front seat passenger, passenger side collision, patient complaining of left hip pain and groin pain, some form of pelvic injury, although cardiovascularly stable.
Take it off.
Patricia is flown to the nearest major trauma centre, the Queen Elizabeth Hospital in Birmingham.
Okay, looks like the lights are on the pad.
100 feet.
18 minutes later, they arrive safely.
Hopefully we'll get you sorted and looked at straight away.
The hospital medical team are on standby, ready to take Patricia into their care as soon as she lands.
Right then, let's go.
Oh, thank you.
You tucked in there? Yeah. All good. She's been comfortable on the way. We've been giving some pain relief. All her observations were stable. We've handed her over now to the trauma team who are doing their assessments. She'll go for a scan and then hopefully get an idea what's going on. She's hysterical and may well be hiding something, bit sinister underneath, we don't know.
Nope.
At base, the Midlands Air Ambulance Critical Care Team, Will Meadows and Faye Pollock, are checking their kit for their 12-hour shift.
Wales tube, large and small.
Large, small, yes and yes.
Scalpel, 22 mil.
Yes.
Yeah. Cool.
We are done.
Today they'll be responding to any emergencies by road and are used to working together as a two-man team.
We can rely on each other wholeheartedly. And one of us has a bad job and needs to chat to somebody about it, then I know that I could ring Will at any time of the day or night to sort of say, ah. It feels as if it's
easy
quite
going,
easy
isn't it?
to work together. Let's go. Exciting little day.
Ambulance services, the patient breathing?
Yeah, he's covered in blood.
Okay, is he breathing?
Yeah.
And is he conscious and awake?
He's awake. Yeah.
Okay, what's the main reason for the call? Is it bleeding?
He's been completely sloshed and then all his face is all blood.
Thank you.
As well as an ambulance, Faye and Will are also dispatched to the reported stabbing. With this type of medical emergency, injuries are often very serious and victims can bleed out quickly before there is a chance to get treatment.
We're going to a 30-year-old male patient in a car park, knife and attackers on scene.
A man has been the victim of a knife attack. Two men allegedly turned on him, slashed his face and head area, and he is now in a local car park.
9-5, thank you, we are on channel. Our ETA is 07 minutes, over.
That's brilliant, thank you.
In the West Midlands, knife crime rates are now 20% higher than last year, and with the potential of an attacker still in the area, the situation could be highly dangerous for the crew.
The number of patients at this time is 1, currently P3, with multiple injuries, including a partial amputation of the right ear so far.
Police are on scene, so it should be safe for us to go in.
After a 7-minute journey, they arrive on scene.
Hello. Hi, mate. My name's Faye. What's your name? Sean. Sean, what happened?
Fell over.
You fell over. Okay, that's fine by me.
I'm in the middle bar.
Yeah.
I'm not the two out. Tell me.
Sean's face and head show extensive blood loss. Witnesses claim that the patient has multiple stab injuries and that he has lost a large amount of blood.
Sean, we're from the air ambulance service, and we're going to come and have a little look at you, clean you up. Do you mind if I just have a little look at your chest and your tummy, just to make sure that there's no other wounds down the bottom end? There's nothing on your chest?
No, not a thing.
With a chance that Sean is either concussed from a blow to the head or in shock, it's essential that Faye and Will check for any hidden injuries that Sean can't see or feel.
Can I take your top off, Sean, just to make sure there's nothing around your back? That's it, good man.
Can we just increase the vent rate a little bit, please? Thank you.
In Coventry, critical care paramedic Jenny, Dr. Naveed and the ambulance team are treating 57-year-old Kavi after he suffered a cardiac arrest. They've managed to restart his heart.
So if we still put those fluids through...
But while Jenny and the team continue to treat him, Naveed is getting as much background as he can from his wife, who was there when he became unwell, to inform his treatment plan.
Hello there. What happened this evening?
We were in bed, we had a meal and everything.
Yeah.
So I've got funny aching in my jaw, in my mouth. And then he was like...
Alright.
Right, I'm just going to release the pressure off his chest.
Any health problems?
He had a stroke in 2018. He had a massive seizure in January.
Right.
He's left paralysed.
Okay. Any heart problems or any breathing
No,
problems?
never.
No? Okay.
Still got a radio. Let's get that Lucas off him. So we'll need a bit of an extrication pan, won't we? So probably a scoop and a trolley at the bottom.
Yeah.
Kavi may have a heartbeat,
So, right, if we split the scoop.
but he needs urgent specialist care from the cardiac team at the hospital.
We'll have to just give him a quick roll in a sec.
Yeah.
Getting us a little bit ready to move.
And getting him down the stairs is not going to be easy.
Ready, steady, roll. Perfect.
He's been placed onto a scoop stretcher, which minimises the amount of movement the patient has to undergo. But moving Kavi downstairs in such a critical condition has its risks.
Do you mind clearing the stuff from the staircase and just everything? Obviously, this is ours, but all the other bits further down from there, do you mind taking the stuff out the hallway?
Getting him downstairs safely in such a tight space presents a whole new challenge for the team.
There we go. So if we slide him to the doorway, and then he's going to have to go down feet first, isn't he? So it's going to be a bit awkward, but... Okay. If we slide him that way, ready, steady, slide. Should we disconnect as much as we can?
Thinking how we're gonna navigate this bend.
We'll have to lift him over this part,
Yeah,
but
that's what I mean.
are you happy taking the top?
Yes.
Is that all right? Ready, steady, lift. Well done, ladies, well done.
Okay, got him.
You okay? Yeah, yeah.
Okay.
Stable.
Let's have that, thank you.
Just sliding.
Okay.
Well done.
Okay,
Good
so
work.
when you're ready, just lower him down.
Go down. Yeah, yeah.
Yeah, that's fine.
Okay.
Do you want to have a quick...
I might as well.
Just want to get him out. Okay. Still got active breathing.
Has got a heartbeat at the moment. He's very poorly, I'm afraid, but we're doing the best we can for him at the moment, okay?
I've lost him so many times. Nearly lost him.
Oh, bless you.
Okay, ready, steady, lift. Oh, that's awkward, isn't it? Yes, please, thank you. Oh, that's okay, we can put it on him if you want. That's okay. That's okay, we can put it on, that's fine.
Right, good.
Okay.
Shall we roll?
Ready to move? Okay, I've got the top end. Ready, steady, shove.
Put yourself. I've got it.
Happy if I start rolling?
Thank you, yeah.
Although the critical care team has managed to get a heartbeat, Kavi collapsed an hour and 6 minutes ago, and he is still unresponsive.
She's got his pupils a size 3. She's not really reacting, but that's to be expected.
His condition is so serious, Jenny and Naveed are ready to intervene if he deteriorates further.
We're just pulling him to the hospital. Okay?
Yeah, yeah.
We'll just go nice and steady, make sure we don't snag anything.
Okay, you good on this side?
Kavi is handed into the care of the emergency team at the hospital. His next few hours will be critical.
Ambulance service, is the patient breathing?
Yes,
What's the main concern?
they've got their foot stuck between the car door and his wedged up the ticket machine. He's got his foot at a very awkward angle. He can't move it. He can't move the car to relieve the pressure.
Is it possible for me to speak to him?
Yeah, I've got on speakerphone. Hello?
Hello there. Okay, so what's your legs trapped between the car door?
It's stuck between the door and the toy dispenser.
Yeah.
And I opened the door like an idiot. And the car rolled forward and shot my leg.
Shot your leg?
Yeah.
Just go straight over this one. Yeah, straight over this one, mate.
Midlands Air Ambulance critical care paramedics Rob Davies and Liam Webb are immediately dispatched. Although the incident happened in a hospital car park, the seriousness of the injury may need urgent treatment at the roadside.
Clear left. He might have fractured his leg, or he's crushed it or something like that. We don't really know at the moment.
If the patient's injuries have resulted in the blood supply being cut off, time is critical.
There could be problems with crush injuries if it's been trapped for a period of time and the leg hasn't had sufficient blood supply. That can cause complications within the leg.
It could result in the patient losing his leg. After 15 minutes of pressure, patients can also get crush syndrome, where toxins are released into the body, causing kidney failure.
First exit.
The critical care team are 20 minutes away.
Hi guys, got an update for you. Briefly had a chat to the OM. Basically the ankle is trapped under the car. Somehow his leg was out while he went through the barrier and is all a bit trapped.
Cheers, Ben.
Oh, there's fire service, isn't it? Even we're far enough out of the way.
Along with the fire service, an ambulance crew is already on site. The operational manager briefs Rob and Liam.
It is, as you can see, that is trapped solid.
Right, okay.
What we tried to do is put the car on full lock, just see if we could ease the car out.
Yeah.
Like that way to ease it.
Okay.
It ain't budging. It's not
okay.
Solid. Doesn't suffer with anything normal, but we're just going to try and get some pain relief into him. So.
Perfect. Fine.
Having been briefed, Liam and Rob need to assess the patient without delay.
Lindsay, I'm Liam. This is Dave.
How you doing, buddy? I'm sorry. No, don't. Hey, don't worry. Don't worry. You're in a lot of pain. We'll get you sorted. What's your name, chap? Dave. I'm Rob, okay? And my mate over there is Liam.
Hello, mate.
Should we give him some morphine and a paracetamol as well if he hasn't had it? Just load him with that.
Morphine in, yeah.
Just calm him down. Can we see anything with that foot then? We can't really get to it, can we?
No, I think we'll leave it as it is.
Yeah.
And then we'll go from there.
With his leg still under severe trauma, Dave needs heavy-duty pain relief. The medication will keep him calm, but time is of the essence.
Can you feel me touching there, David?
The fact that Dave still has some feeling in his leg is good news. It means that there is still circulation, but there is still a risk he could suffer crush syndrome.
You're right there, Dave? You're struggling? In what way?
It's pain.
It's painful. Okay, all right. I don't want you to panic. We'll get you sorted, David. All right.
Thank you, Dave.
David, have you had any paracetamol today?
No, I did 12 hours ago or so.
Okay, so you're all right to have it?
Yeah.
So we'll give you some paracetamol through that line as well, all right? Okay.
It's only when the fire service can winch the car away and release Dave's leg that the crew will know how much damage has been done as a result of the crush. For now, all Liam and Rob can do is prepare to get an intravenous line into his arm and give Dave pain relief.
Nice, steady breaths, Dave. You'll be out very shortly, mate.
Critical care paramedics Will Meadows and Faye Pollock are in Dudley.
Hit me with a bar.
A bar, metal bar?
Treating 36-year-old Sean, who says he's been attacked with a metal bar while out drinking with friends. Witnesses report he was stabbed repeatedly with a meat cleaver.
I need my phone now. I need my phone so I can ring the missus.
Sean seems more worried about his phone that was lost in the attack, but he could have sustained an injury he isn't even aware of.
He's got nothing else at the back of his head, has he? I didn't look at his head. It's just dried blood, isn't it?
A stab wound can be small, but if a blade penetrated into an organ or artery, it could be fatal.
Let's just have a quick look at this arm as well. Good stuff. This side. Any pain in your groin?
No.
Any pain down your legs?
No.
No?
Although they've examined him
And you don't think that you've got any new blood?
and not found any stab wounds on his body, the concern is now the injuries to his face and head. But the amount of blood is making it hard for Faye and Will to assess.
Do you feel well in yourself?
Yeah.
Right, this is still bleeding, this, buddy, so we're going to have to put a bit of pressure on it. Do you reckon you can pinch that there for us? Does it hurt? Yeah? Pinch that nice and hard. okay? And just keep it nice and still for us. You got a really good cut above your eye here, just below your tattoo that says 1.
Yeah.
Yeah? That's going to need seeing too, mate, so it's a bit of wound closure at the hospital.
Yeah, close.
Okay, and your ear, you look at me, you see this sort of part of your ear there? It's slipped all the way across and it's just hanging on. So that's going to need a bit of wound care as well.
The injuries to Sean's head and face are extensive, and the team need to investigate the possibility that he could have suffered trauma to the brain. The more information they can get about the attack, the better the chance of discovering a potentially life-threatening injury.
Did you say you think he'd done it with a metal bar rather than a nut, or do you think it was a knife?
He shot me with the cleaver.
Yeah, he said
meat cleaver. Sorry, I didn't hear that bit.
Well, him with the bar in the house, but then he shot me with the meat cleaver, that's all.
And you said something about your teeth as well, didn't you?
Oh yeah, and not a fucking twitchy there.
Yeah.
Oh yeah, you got an inside. Do you think you swallowed that, or is that?
Oh, I think so.
Did you spat it out?
Yeah, it tasted like sharp and it was
Oh.
all sore.
And you swallowed it. It's gone down.
I think so.
How much pain are you in? A lot of pain or non-pain? It's just a numb. Nothing at all. You got no pain in this other ear?
No.
Have you got blood on that? Is there a cut in there as well? That looks like fresh blood.
Oh yeah.
Yeah, he has, me. So bit of gauze there, bit of gauze there.
Bit of gauze there.
And just bandage it.
And then bandage it all up. Hello, how you doing?
Faye and Will are satisfied Sean is not in any immediate danger and can be taken into the care of the ambulance crew who can treat his wounds.
So, this is Sean, 36-year-old gentleman. Gentleman has turned on Sean with a meat cleaver and he's sustained 2 men and he's sustained 3 injuries. One is a 1-inch size partial thickness laceration. Right ear is partially, I say amputated, it's just a really thick, full thickness cut just here and he's in the lobe of his ear. Yeah. Hasn't affected his hearing at all. And then he's got a tiny sort of paper cut one on this side. So they all need a little bit of TLC and possibly his ear needs a good bit of Max Fax and a bit of a stitch in it. Yeah. We have had a good clean of his chest and we can't find any other wounds. All this blood is just coming from his ear.
It would seem patient Sean has been unbelievably lucky, coming away with only 3 lacerations.
I'm off on.
Mate, they're on it, they are looking for it.
I think they found an iPhone, but
I know I have an iPhone, it's Nokia.
Nokia, I know, yeah. So they're looking for the Nokia.
If they don't find it, I will.
I'm going to guess you've got to go and have some glue or something.
Yeah, he's going to have to go in.
I love glue.
Night is drawing in, temperatures are dipping, but despite his injuries, Sean won't go to hospital until he finds his phone.
Yeah, but he won't go on without his phone.
Without proper dressing and closing, the wounds could get infected and lead to more serious illness.
Sure. Let's get you checked over.
I need a bag then.
Come on.
Bye, bud.
With the help of the police, Sean finally agrees to get onto the ambulance.
Yeah, let's see what we can do. Yeah, they're going to sort that.
Here you go, mate. Let me get a seat for you.
I don't want to. I want my phone.
Yeah, they're going to sort it.
Take your seat there, buddy, and I'll.
They're going in there. They're going to sort it. Sit down. Sit down, please, so these people can help you.
That bandage is coming off, innit? You need to try and keep it where it is, yeah? Because that's just protecting those wounds. Right, so, Sean, it's going to be a trip down to Russell's Hall.
Yeah, I don't mind the Russell's Hall.
Sean can now be handed into the care of the ambulance crew for the journey to hospital.
Sean, take care, mate.
Why are you leaving me now?
Yeah, I'll leave you with these ladies.
We'll take care of you, okay?
30 miles away in Stafford.
All right, Dave. How's the morphine helping a bit?
At the county hospital car park, critical care team Rob and Liam are assisting 60-year-old Dave, who has trapped his leg between his car and his car door.
So numbers are all good, blood pressure, pulse, sats, all that's fine. It's tight on the calf and also on his thigh a little bit.
Okay. Having checked Dave's blood pressure, breathing and heart rate, all appears to be okay. But with the leg having been trapped now for 30 minutes, he's at risk of getting crush syndrome, a condition which could result in life-threatening kidney failure.
Nice, steady breaths, Dave. Try and take a breath in and hold it a bit before you breathe it out.
The fire service are now in position with a winch and are ready to try and move the car and release Dave's leg.
Yeah, keep going. Yeah, keep going like that.
But after just a few seconds, the winch fails.
Dave, has that released a bit of pressure off your leg there?
Release pressure, yeah.
Yeah, does it feel better?
No, I can't move it.
It's essential they get Dave's leg freed from where it's been trapped. The winch is attached to the car once again.
How we doing, team? All right? We all set to go, are we? Yeah?
Perfect.
As the firefighters start moving the car, Rob supports Dave's leg.
Oh, Dave. Dave?
Yeah?
Can you lift your right leg up now? How does that feel in the hip?
Feels all right.
In the hip, no pain? Let's just try and get your leg up into the car, and then we'll just we'll get it so we can get you out.
Forward, yeah.
And then just spin yourself round. How does that feel?
Right, cheers, guys. I'm off here.
Shut the door, you'll be away, wouldn't you?
See you later.
Did you pay your ticket?
No, they charge a fortune.
With Dave's leg now free, Rob and Liam want to give him a thorough check to make sure the blood supply to his foot is okay.
What we'd like to do, mate, is get you out, sit you on the bed, get you in the back of the ambulance and just have a good look at it. Just make sure everything's all right. Okay, so let's just roll it forward. That'll do, stop there, stop there. Handbrake on. So do you want to bring your other leg out to meet it?
Yeah. We're going to bring the bed there.
Yeah, and we'll bring the bread to you, Dave. Just stay there for a sec. I know it feels a bit dramatic.
Even if Dave can walk on the leg, Rob and Liam still need to be sure that crush syndrome hasn't taken hold, which would seriously affect his kidneys.
Any change on that, standing on it?
I can feel a bit of pain.
Okay, all right. Have a seat on the bed. We'll do some more obs on you, Dave. We'll just have a little look at you. Have a look at your leg.
Is that painful? Sorry.
Not particularly. No. Can I get you to lift your right leg up independently? Okay, so if I push down like that on your leg, any pain in the bone? Does it feel like painful in the bone? What about in there? Okay. Move this foot independently, fine, no problem. So, a bit of swelling there compared to that one.
Rob's observations don't point to any bone or circulation issues.
Have you got any problems with your kidneys?
I've only got one.
You only got one? Why have you only got one? What happened to the other one? We were born with one, or we were always born with one? Okay.
The news Dave only has one kidney is cause for concern for the critical care team.
He's got muscle damage, really. He's got quite big indents to his leg. The key thing for that is sometimes when you have pressure on a muscle for a long time, it releases all these chemicals, basically, and they get into your bloodstream, and they're really bad. So we just need to monitor him and see how he goes from there. But he's quite lucky not to have broken his leg.
For now, it's time for Dave to be wheeled just across the car park into hospital, so the medics there can keep an eye on his bloods.
David, we're going to leave you with the ambulance crew, if that's okay, and they'll just take you for the long and arduous journey through the car park.